Local stories, local people. We're taking you inside Western Mass news. It's the Even Better Western Mass podcast with Dave Madsen.
Good to have you with us for this week's edition of Even Better Western Mass. Hard to believe that we are now in the 6th week of staying at home and social distancing. Wherever you are, I hope you're doing as well as can be expected, and hopefully we're looking at some light at the end of this very long tunnel. Later in this week's edition of Even Better, I have a look at the financial strain that this shutdown has been putting on a local nonprofit and how it's working with a local bank to continue serving its clients and pay its employees. But first, my interview with Dr. Erika Hamilton, Director of Microbiology Teaching Services and a senior lecturer at UMass in Amherst. Now, if you've watched the Western Mass News coronavirus program weekdays at 12:30, you've heard Dr. Hamilton's insight and perspective on COVID-19. Dr. Hamilton and I talked about where we might be headed and how we may be dealing with COVID-19 in the weeks, months, and maybe even years to come. By the way, this was a Zoom interview, but due to someone's, technical deficiencies, that would be my technical deficiencies, this is only the audio portion. You know, we heard yesterday the president looking to reopen parts of the country before May the 1st. What are your thoughts on that? And do you think that may be too soon?
I do think it's too soon. Looking at some of the data in Massachusetts, at least, our cases are still on the rise. Our deaths are still on the rise. So you don't want to start opening things until the number of cases and the number of deaths have it leveled off and actually begun to decrease. So what would happen is if you open up too soon, people go out and they're going to spread the virus to others, and we'll have another spike in cases.
Do you think the American people and people as a whole will be really the ones who determine this?
Some people might. Other people may be chomping at the bit to get out and do something because they've been cooped up for too long and have gotten a little stir crazy. And other people are going to be reticent to go out, but some of the things that people want to do the most, whether it's going to a restaurant or going to the movies, those will have to be actually the last things that open up. So as Trump outlined the 3 phases of suggestions of how states could reopen again, and if we start to follow along those 3 phases, and it sounds like the CDC was the one who kind of came up with the plan, the first things that will come out, or the first things that will reopen, will be things like schools, daycare centers, things that children will require to be able to need. It's not going to be a movie theater. And bars. Those will be some of the last things that will reopen. And then once schools are back open again, and that has turned out to be safe, and we have not seen an increase in cases, what will happen is some non-essential stores will begin to open up. And then eventually we will reach the point to where we can have larger mass gatherings. But I think that that's going to be later than most people would like to see.
Do you think the lack of a COVID-19 vaccine is going to be the biggest barrier to this?
It will be part of it, yes. There will be other ways. We know how it spreads, so it's not a mystery as to how COVID-19 spreads. So there will be ways to combat that. We're still going to have to maintain social distancing for probably longer than people would like. But once we have the vaccine, once we can get it to people, and once we know that it works, it's going to help us to go back to kind of normal, to where we were before this started.
One of the things I wonder out of all this is if this is kind of a wake-up call for not only Americans, but for the world, that maybe we're going too fast, that it's time to slow down and really take a look at what we're doing as a whole.
Well, you're going to see more instances of things like this happen with the way that we treat the environment. So COVID-19, SARS, MERS, Ebola, and HIV were all diseases that came from animals and jumped to humans. And one of the reasons that happened was that as we push more into the environment, as we cut down more trees, as we capture and eat more wild game, and it depends on what part of the world you're in, whether or not this happens, but as mistreat the environment more and more and more, you're going to see more of this happen. So it happens anyway, but we're causing it to happen more quickly. And so if we can get better about the environment and discouraging things like capture and sale of wild animals, destruction of the rainforest, pushing into parts of the natural world where we probably shouldn't be, and we begin to sort of reduce some of our really intense contact with these areas, you'll see some of this decrease. But we're kind of causing this to happen somewhat to ourselves by how we're treating the planet. And if we can back off on that, I think that you'll start to see these instances decrease. And if we don't, you'll start to see them increase.
I actually, there's still this debate and on some of the news channels as far as, what's the difference between COVID-19 and the regular flu and SARS?
Well, the two viruses are different. So if you could shrink down and look at these things, you would see that they are actually different from each other. How they organize their genetic material is very different. Their structure is different. So they're spread in the same way. They're spread by respiratory droplets, and they infect our respiratory tract. But after that, there's a lot of differences between the two of them. So they're not, because they are inherently different things, they are going to behave differently. There's more than one type of, it's not an attractive thing to talk about, but there's more than one type of diarrheal disease out there. Some are caused by viruses, some are caused by bacteria. And how they're spread and their signs and symptoms seem similar, but the organisms that cause them are different. And this leads to different treatment options, different severities of how people become, some people are mildly ill, other people are more severely ill. And this is what we're seeing now. It's spread the same way. It seems really similar because it's a respiratory infection, but in reality, these two microorganisms are super different from each other. And that is what's leading to the more severe cases, the higher infection rate, and the higher death rate that we're seeing.
One of the things that frightens me about this too is that there are so many, because as you were saying, that people react to it in different ways. The number of people who may be out there who have it and don't know it and are carriers.
That is scary. Now, we don't have that with the flu. So that shows you really right there what one of the big differences is. With the flu, you contract it, and you do have this phase with any infectious disease where you catch it and you're not showing signs and symptoms for a few days, and then you get sick. But with the flu, you don't really shed the most virus until you've started to become ill, until you start to show the signs and symptoms. And let's face it, when you have the flu, you feel horrible and you're not going to go out and you're not going to spread the virus around. However, with COVID-19, that space of time between when you contract it and when you start to show signs and symptoms, you're shedding a lot of virus. You're an asymptomatic person who has it. And that's the real danger of this microorganism, is that people have it, they don't know they have it, and they are going about their lives and shedding it and passing it to other people. And it's a scary thing to have happen.
The other thing I wonder too is that once you've had it, and I've heard different responses to this too, that, well, you're immune to it, but then you've heard other stories where, well, you may not necessarily be immune to it, that there's a chance you could get it again.
As far as we know right now, you will be immune to it. This is confusing. This is a brand new thing. So COVID-19 is a new phenomenon in humans. And so people are trying to study it as fast as they can to learn more about it. But it's hard work, it takes time, and it's super frustrating for people to hear, well, we're not sure, and this study shows this, and this study shows that. Scientists aren't being confusing on purpose. This is just hard information to sort out. And unfortunately, trying to determine whether or not you're going to be infected again, what we need are people who have had the virus, who have survived it, and then wait to see if they become infected with it again. Asking them to purposely reinfect themselves would be a kind of not a nice thing to do. So it's a bit of a waiting game, and there are tests that can be done to determine if someone carries antibodies against the virus. And that is one of the tests that's available on the market. But as far as looking at the virus and other types of viruses that are similar to it, I think people will end up immune to it afterwards. How long, we don't know.
I think you just touched on something there, that saying that we're going to have to be patient with this. That I think the other part of it is too, until there's a vaccine for it, it sounds like it's going to be around, and it's going to have an impact on all of our lives.
It will be around. The common head cold is around. The flu virus is around. And the only thing that's really going to stop it from having this significant impact on our daily lives is a vaccine. And hopefully by this time next year, we've got one and it will work well enough so that we can really finally go back to our pre-COVID lives.
Do you think too the risk that we run too by reopening many things too soon is the fact that, well, this could come back in a big way in the fall?
It could, or even in the summer.
Yeah.
There is no good information. There's no significant data that shows that this virus is killed in hot or humid weather. So it could hang around over the summer, whereas sometimes other viruses maybe don't like hot and humid weather as much. So it may be here all summer long. We don't know. But yeah, if we open up too early and people go out and start interacting in large groups again, we could see another spike in cases and in deaths.
And you touched on it too. With the CDC and the World Health Organization, and everything else, it's kind of a learning curve for everyone, it seems.
It is. And again, scientists really don't. It's so frustrating when you read in the news that wear your face mask, don't wear your face mask. You are immune, you aren't immune. And this is not in an intentional confusion. People aren't, the CDC and the World Health Organization they're doing the best that they can with the information that's available. And because this is such a new phenomenon, there's not a lot of information available. And researchers and scientists are working as fast as they can and as hard as they can to sort it out, but it's not easy work. It's not an easy thing to do. They're doing the best they can.
Yeah, it sounds like we're all doing the best we can in this
Yeah.
whole thing. Were you surprised by this? I mean, you've studied this, and this is hit as hard as it's hit?
Actually, I'm not. I think if you talk to a lot of people who work in public health or epidemiology or microbiology, a pandemic like this was bound to happen at some point. It's like talking to a geologist. An earthquake in certain areas is bound to happen at some point. Simply because of the way pathogens work and the way microbes work, we've gotten used to not having significant pandemics and significant illnesses due to vaccines, antibiotics, and modern healthcare. This used to be a common occurrence, or at least epidemics, if not pandemics, used to happen relatively frequently. We've gotten used to it not happening. But no, I don't think anybody who is, for lack of a better term, in the business is really surprised at this. We just didn't know what it would be necessarily, or the extent to which it would affect people.
Now, when we do reopen, my guess is it would be a big mistake for us to think that we can return to everything the way it was, say, pre-January. That we've got to be more careful. As far as one of the things that's gotten us, for everybody to do, is wash their hands and be more careful about our cleanliness habits.
That's a good thing. So COVID-19 is not the only organism that is spread through respiratory droplets. So is the influenza virus. So are head cold viruses. So the better we are at watching what we're doing when we cough or sneeze, washing our hands regularly. In fact, washing your hands regularly decreases not only the chances of respiratory illnesses, but things that are spread through the fecal oral route. So some intestinal diseases as well. Hopefully, if people continue to do this and are more careful, maybe we'll even start to see a bit of a decrease in some of those across the country.
What's your take? What do you think we learned from all this? And it's hard to say when all is said and done, because I think it sounds like it's always going to be part of our lives. But what's the biggest takeaway for you? What do we learn from all of this?
Oh, that's a good question. I think it's a good reminder that we are not the dominant species on the planet. We think we are. We like to think we are. But this is a microbe that is 1,000 times smaller than the width of a human hair, and it has brought the planet to its knees. So that's something to remember. We're really not the dominant species on the planet. And it's a reminder that when pushed, humans can do some pretty spectacular things. So for the most part, people are coming together all across the country and across the world to try and stop this. Our healthcare workers have been doing a great job. Other people have been doing what they can to stay home. They're helping each other out, whether it's buying food, checking on a neighbor who needs it, sewing masks. So I think in times of stress like this, humans can come together and show the good parts of them, the parts that help us relate to each other and support each other. And I think that's been really good to see.
This has been a wake-up call for all of us.
It has been. It's shown what's important in life. It's shown who the real important workers are in our society. And sometimes it's not the people you think they are. Just how to treat each other a little bit better and try to be more understanding and more helpful. And it does make things better in the world when you do that.
And is there anything else you want to add?
Again, I know people get upset by all of the conflicting information that's out there, and it's not, a lot of it is not necessarily conflicting information. Sometimes information from researchers is presented maybe not in the best way. Mm-hmm. And it can be confusing. And research is confusing. Just to remind, scientific research is confusing. You have a body of knowledge that you know. So we have this information that we know. But then you start to ask the questions. And how you formulate the questions and then the process or the experiments you use to answer the questions is really, really important. And other scientists then evaluating that work is important. And sometimes you can ask the same question, but if you do the experiments differently, you get a different answer. And I know that seems really contradictory, but it happens. And some of the conflicting information that's coming out is because science is a slow process sometimes. The work itself is really hard. So when you work with COVID-19 in a lab, it's a pain in the neck to work with. So it's very, very difficult to grow, to maintain, to work with it. And then people who work in public health and epidemiology who do a lot of modeling work, it's really influenced by human behavior. And we all know human behavior can get wacky sometimes. So they can have the best model out there, but then humans start to do something unexpected and the model just gets destroyed or changed somehow. So I know that people get frustrated by, first we weren't supposed to wear masks, now we're supposed to wear masks. That's happening because as we go deeper into this pandemic, scientists are learning more. And as we learn more, that's going to change recommendations. It doesn't mean that the initial recommendation was wrong. What it means is we've now learned something else.
My thanks to Dr. Erika Hamilton. She'll be a daily contributor to our coronavirus special Monday through Friday at 12:30 on Western Mass News for the duration of this shutdown. Well, our next story is about how Riverside Industries in Easthampton, an agency that serves people with disabilities in 33 cities and towns in Franklin, Hampshire, and Hampden counties, worked with its community bank, Bank ESB, to obtain a PPP loan to allow Riverside to continue serving its more than 250 clients and its nearly 200 employees during this COVID-19 shutdown. Riverside's facilities, 1 Cottage Street, Easthampton, shut down on March 17th, but its mission did not stop. I spoke with Riverside's president and CEO, Shar Gentes, and Matt Sosik, Bank ESB president and CEO, about what this loan means. What's been the impact on Riverside by the COVID-19?
Thanks. Well, I was just looking at the calendar. We're now into our 5th week. We did have to close our facility. Our mission now is we call people a couple times a week. We're checking on people, making sure all our 250 are okay, that they have what they need. We are teaching as much as we can via phone. We're in the process of evaluating who has a laptop, who has an iPad. How can we have more communication with people? We also communicate with our employees. Every week, everyone gets a call. So over 200 people are getting a call from supervisors, from directors. So we're not there at the facility. So a lot of people are living home with their parents. About half of our individuals live with parents or siblings, and the other half live in residential programs.
Now, money-wise, as far as your budget is concerned, I know you've been taking care of those employees as much as you possibly can, but that's really put a strain on your budget.
Yeah, for sure. So the state has agreed to reimburse all day programs that close, which are plentiful, 80% of some of the funding. So we took really a significant hit right there. And then some of the other funding wasn't reimbursed at all. So that was another financial hit. We have been able to keep all people employed for those 4 weeks. And without this PPP, payroll protection program, that was going to probably have to come. a huge thank you to Matt and his crew at Easthampton Savings Bank, who I called one day and Matt picked up the phone. Matt, I cannot thank you enough, because there's few presidents of a bank who will answer their cell phone and talk to a little old Chargentes on a rainy day and listen to my woes and respond with such generosity and grace and care. So thank you so much.
Matt, let's talk about that response and what the bank has done.
Yeah, I don't know what you know about that particular program, but irrespective sort of the PPP, and when Shar called, I don't know if I had the context. I was thinking of so many of the local businesses, obviously your restaurants and the whole hospitality industry that was really shuttered and blown up financially. But I didn't even connect the dots back to Riverside until Shar explained the situation. And the funding gap was pretty clear and evident. And as Shar said, of course, I answer her call because, she is a champion in our whole region for what Riverside does. It's an incredible organization. So for us to want to help her, that's obvious, clear. Then the next question is what could we do and how much of a dent and how much of funding could we provide that could fill this hole that she was facing. And we sort of got to a little bit of the brass tacks, but Mo Mahar, who works for us, took it from there, and Mo and Shar were able to put together an application under the SBA Paycheck Protection Program that did a lot to. Shar can attest to this better than I can, because she sleeps with the numbers on her ceiling and she's staring at and when there's red ink, it doesn't provide for a good night's sleep. And so it was just great to be able to help. And, this is why we're in this community banking business anyway. Most of us could be doing that are community bankers. We could be doing other things in other, the Wall Streets of the world. This is why we do this. So to help an organization like Riverside was just, it's heartwarming, to be quite honest with you.
Matt, let's talk about this type of loan, because my understanding, what type it was, but my understanding, it's also the first time that you've dealt with this type of loan.
Well, the funny thing about the whole PPP program, lots of P's there. It's a brand new SBA program that came out of the CARES Act. That was only approved by Congress, 3 weeks, something like that ago. Mm-hmm. So this really rushed out onto the street. It was really very much needed. There's so many desperate businesses, but it was rushed, and no fault of anybody's, but there were a lot of holes in this thing. So we really had to pull it together kind of in the dark closet. They dripped more guidance to us as they got it, as they formulated and built the program out. So Shar and Riverside, they were our first closing. I probably will admit, in fact, publicly for the first time, that given the need, we put Riverside at the top, and we wanted to make sure that they were funded first. But it was no small task, because again, love the SBA, love the program, but they, again, no discredit to them, they didn't know what they were doing. How could they have? So it was trying, and no banker that I've talked to has ever managed and administrated a plan like this before in their careers. And I've got friends in this business over 45 years. It's just a first.
Shar, what does this money do for you?
Oh, you hear that? That's,
you can breathe.
One thing it does. And geez, I was just kind of natural. It allows us to continue to pay 200 employees. And what does that mean? Well, first of all, I feel it's the right thing. Of course, if you can do it, it's the right thing. I understand there's a lot of employers who would want to do it, but can't do it. We were able to do it for short term. We knew about the PP program. We knew we had to have Easthampton Savings Bank as a partner. They were a preferred applicant. And without ESB, really, we felt our chances weren't going to be as good. So it allows us to have individuals who've worked for Riverside for years, who are human service workers who live paycheck to paycheck, to have a little less stress during this pandemic. They know they're paid, their money is coming in. They can buy food. They know their health insurance is going to continue. God forbid that they need it right now. And it allows us to take care of our employees during that we want to for 8 weeks. And that's the thing, it's 8 weeks. The state will be giving us some money in April, May, and June. Again, not nearly what we would normally get. And it will help us bridge a gap for a couple more weeks. We will be probably applying for more loans if we have to. Our first hope is that our doors will open back up in June. That's what our first hope is. But I think there's a lot of employees who are very happy. I've been getting some incredible emails of gratitude from our employees, well-deserved employees who have a paycheck that they know is coming in.
Indeed. I mean, as far as both of you are concerned, as we started 2020 and looked ahead to the new year, this is the last thing on this God-given earth any of us even thought, ever even thought was going to happen.
Ever imagine? I mean, I thought building a bridge was tough, and ESB was right there with us as well. It's like, who has to replace a bridge? What nonprofit has to replace a bridge on, their property? And our champion ESB came through with us, gave us a significant amount of funds to help us with that bridge. I thought that was going to be probably the biggest thing I would have to deal with in my tenure. And then, no, out of nowhere comes this pandemic that all CEOs, everybody, everywhere, are dealing with. And you couldn't plan for this. Who would ever think? I just don't know. It's shocking. It's very surreal, and it's scary on many levels for, I think, a lot of people.
Sure. Matt, how about the impact on the banking industry, especially local banks?
Yeah, a lot of that remains to be seen, Dave. I mean, we are really a financially sound industry, and locally, I'll certainly speak for ourselves. I mean, we'll have no problem financially weathering the storm, and the industry locally, the other competitors that in the area, we're all very, very sound financially. But this is crazy because we don't really know. Shar touched on it. There's still uncertainties here. We're starting to get some optimism built in to the news feeds with what appears to be some control over infection rates, et cetera. But we still have uncertainties. Shar still does not know. Am I going to be able to open June 1, or is that going to be August 1st, or is it even better than that? So the same goes for us. We have as an industry, and certainly ESB, we've had to shutter our lobbies just for the safety of all our customers and our employees, and everything's going through the drive up. Sounds small, at least we're open, but it's been a table flip for a lot of our customers that are daily walking into our branches. So everybody's had to sort of alter course and make do with these strange times. Who would have ever thought? As a banker, Shar can't predict for Riverside a pandemic. We could never have predicted that we'd have all of our lobbies closed on the 13th of April in 2020. It's crazy.
But I mean, the bigger picture now is this is just another wonderful example of a community coming together that, as we go through our daily lives and everything, we kind of forget about, the other person. We just, we worry about what's important to us. But this, I think, has brought it all home for all of us. And
yeah, for sure. And Sharon and I had to do a virtual hug, but it's because there is 187, did I get the number right or wrong there, Shar, but to almost 200 employees that their whole lives as they knew them, the order of their lives financially and in all respects, were really wrapped up in this. This is about making a decision here to go with this PPP program that touches probably thousands of people's lives, really, Shar, when you extrapolate out from the employee base. So yeah, for us, Dave, it's chaos, and it's sort of a morass of bad news that we tend to see. For us, this is a bend on the COVID-19 story, to talk about the humanity of it, to talk about the fact that there are plenty of silver linings, and there's still just good old-fashioned human beings helping human beings. And to me, to Shar, to all of us, that's what this particular story really meant to us, and that's how it resonated.
You know what you said, Matt, about how many people. Yes, it's over 200 individuals who we employ. However, that's 200 families. So, and that's a lot of people. It's a lot of children. It's a lot of people's emotional health, and that was of concern to the senior management team and the board, of course. People's emotional health right now, we were very concerned about, and knew that this program was going to give us all of us a huge relief and allow all of us to sleep well. So,
Matt, I know with Easthampton Savings Bank, I've our Bank ESB. See, you can tell I've been around here for a long time.
That's great. Yeah, that's fine.
That you're also a business too, and you have hundreds of employees all over. That Bank ESB has taken care of them too. I've heard some very, very good things about what you folks are doing, because that's the other part of it for you.
Yeah, well, we have that critical financial soundness, and a nonprofit's not going to have that war chest, right? So for us, it still was a big decision, Dave, to turn around and say to 475 employees, no matter what happens here, people, when this really started to break and unfold, we just turned to our employees and said, we are going to pay you through this entire ordeal, whatever that turns out to be and what it turns out to mean. And we're going to make sure that we're not hitting any of their time off, their PTO, as we call it. We're just covering everybody. And there are moms that their children are grown and they're on the job every day, and there are moms with just 2, 3, 4 youngsters at home that aren't in school, right? And so we're that mom, she's working for us, she's getting paid, and she's at home. And it's a commitment we made early in this. For the Shar didn't have the benefit of being able to tell her employees that don't worry about it, right? Because that's not the budget constraints of a company like Riverside. I know she wanted to do it because she said the emotional health. It means so much to an employee to hear from their employer that they got their back. We were lucky enough to be able to tell our employees that. To have you hear that out on the street, that's nice. It really is. But we did it. We did it because it was the right thing to do, and we were able to do it.
I think that's the bottom line too. It's the right thing to do.
Yep.
In both instances.
yeah, it is the right thing to do. We didn't even hesitate. It didn't even come up. We were just like, can we do it? And for how long can we do it? And that was really the question, not are we going to do it, but for how long can we do it? And I think, for us, right now we're focusing on remote learning and how much more can we do and making sure everybody's safe and teaching people precautions. But we know in the next 2 weeks, we're shifting to, okay, when we come back, what is it going to be like? How are we going to do things differently? Riverside's certainly been affected by this in so many levels. All the businesses we run, our production department had to close. That's a source of income. Our lawn care business had to close. Our garden, we got all these starters. We're not sure what we're going to do with them yet. We still have that fallout,
Sure.
So we'll see. I do feel like Riverside is strong. I feel like the community embraces us. They support us. We will do what we have to because we are Riverside strong.
My thanks to both Shar and Matt for being with me for this week's edition of Even Better. Now, if you'd like to support Riverside Industries during this unprecedented time, you can make a donation. Get more information, too, by visiting rsi.org. We have seen and heard some very strange things during this coronavirus shutdown. Taneytown, Maryland police are reminding residents there to wear pants when they go to their mailbox to pick up their mail. In a Facebook post, police also stated, "You know who you are. This is your final warning. Can't make this stuff up." I'm Dave Madsen. Thanks for watching or listening to this week's edition of Even Better Western Mass. Stay well, stay home, and if you can, join us next week. This is our fight. Right here, right now. This is rising to the challenge in an unprecedented time. This is coming together as we sit apart. This is lending a hand as much as we can. This is our community, and we will stay strong. This is Western Mass. We're in this together.